You know how a lot of value health plans look cheap upfront, but once you dig in, you will find room rent caps, tiny bonuses, and restoration that only works some of the time? Well, Zuno's flagship Zuno Health Insurance tries to pack a lot into a compact price, multiple variants, maternity on higher tiers, and even a 1-year free renewal if you stay claim free. Now, the question is, how comprehensive is it really, and what trade-offs should you know before you buy? Let's break it down clearly. Hi folks, I'm Shashank and you're watching Ditto Insurance. We've helped over 9 lakh Indians navigate insurance with honest and unbiased guidance. And if you would like a free consultation where you can understand about insurance or pick the right plan with the help of our IDIA certified advisors, then you can check out the link in the description. There'll be no spam, just honest answers. Alright, let's get into it. Today we're decoding Zuno Health Insurance, the main base plan, and we'll also touch on their super top up. We'll cover the insurer's performance, plan conditions, how silver, gold, and platinum actually differ, the add-ons, the waiting periods, discounts, and premiums, of course. So by the end, you'll know exactly where Zuno fits and whether it fits you. Okay, let's begin. Quick note up front, Zuno is a non-partner insurer for us at Ditto. Everything here is compiled from Zuno's website, policy documents, and validated aggregator sources. And like always, this is going to be an unbiased review. Alright. Zuno General Insurance, formerly known as Edelweiss General Insurance, was founded in 2016, headquartered in Mumbai. They do motor, health, home, and marine with an app-first digital approach. On health, the cashless network spans over 6,200 plus hospitals across India. Performance-wise, here's a snapshot. This averages around 22 to 25, unless noted. Now, CSR is around 90%. ICR, that is incurred claim ratio, is 97%, which is the average of 21 to 24. Now, there are 15 complaints per 10,000 claims settled. Cashless network, as we said, is 6,200 plus, and annual wellness, that is gross written premium, is around 323 crore rupees. Now, what does that mean for you? CSR at 90% is decent, but a notch below some of the known private players. ICR 97% hints at tight pricing headroom. Now, complaints look controlled. Scale is still modest. Now, let's look at the plan architecture. The base plan comes in 3 variants: silver, gold, and platinum. You can buy it individual or family floater for up to 2 adults and 3 children. Entry starts at 3 months for kids and goes up to 65 years for adults under silver and gold, with no maximum entry age under platinum. Children on floater become adult at 26 and move to a separate plan with continuity. Lifelong renewability is also there. Tenure options are 1, 2, or 3 years. Some insured options are simple. Silver is 5 lakhs, gold gives you 7.5 lakhs, 10 lakhs, 15 lakhs, or 20 lakhs. Platinum jumps to 50 lakhs and 1 crore rupees. Now, one important caveat across the variants: if you're 61 or above, there's a mandatory 20% copay per claim. Now, let's see how the variants actually differ and what it matters in practice. Now, let's start with rooms, because that's where proportionate deductions usually creep in. Zuno's generic rule says up to 2 lakh rupees sum insured. Room is capped at 1% of sum insured for a normal room and 2% for ICU. Above that, single private room with no ICU capping. For the sum insured that we're discussing here, assume single private room is your operative cap across gold and platinum. Now, step into high category, say a suite, and you risk proportionate deductions. Pre and post hospitalization expands as you climb. Silver covers 30-60, gold gives you 60-90, platinum gives you 90-180. Daycare, domiciliary, and AYUSH are covered up to sum insured in all of the 3, so there's no problem there. There's an annual health checkup as well, which is cashless at network facilities for a specified test list. Typically 1 insured in a floater, claim-free year, and age over 18. Now, Zuno states no disease by sublimits, which is good, but pay attention to how your cover grows and replenishes. On no claim bonuses, silver adds 10% of sum insured each claim-free year up to 50%. Gold and platinum add 50% per claim-free year up to 100%. On the restoration front, silver doesn't have it in the base. You add it if you need it through an add-on. Gold and platinum restores 100% once a year, but for different illnesses, for same illnesses recharge, you will still look at recharge add-on, which is available under gold and platinum variant. A few variant level inclusions you will feel are road ambulance limits climb from 1,500 on silver to 3,000 on gold to 10,000 rupees on platinum. Organ donor coverage is not available on silver, up to 1 lakh rupees on gold and up to 2 lakh rupees on platinum. Maternity opens only on higher sum insured tiers. There's no maternity on silver, up to 50,000 rupees on gold and up to 2 lakh rupees rupees on platinum with a 4-year waiting period. Two more levers here. There's built-in critical illness and cash benefit. Gold pays a lump sum of 50% of sum insured on this critical illness. Platinum pays 100%. Hospital cash starts at 500 rupees per day on silver from day 4 to day 10, 1000 rupees per day on gold, and 1500 per day on platinum. A recovery benefit kicks in from day 11 to day 20 of hospitalization on gold and platinum. Now, if you opt for shared accommodation, you get an extra daily cash. That's 800 rupees on silver, 1000 rupees on gold, 1200 rupees on platinum, each with maximum limits defined. There's also an assistance layer where if you are 150 kilometers away from home within India and travel is under 90 days, medical referral, evacuation or repatriation, case monitoring, a compassionate visit, return of mortal remains, and second medical options, but always route it through with approved service provider with prior approval. Now, waiting periods, know these before you switch. Accidents are covered from day 1, so no issues. Otherwise, there's a 30-day initial wait. Zuno has a special 90-day wait for diabetes, hypertension, and cardiac ailments and their complications. Think CAD, stroke, nephropathy, neuropathy, lacemic shocks. Specified illnesses carry a 2-year waiting period, and pre-existing diseases are 3 years by default under silver and gold, and 2 years under platinum variant. Now, let's look at some add-ons that can change your experience. If you buy silver, you can add restoration for a different illness 100% once a year. If you want true durability across repeated episodes, take recharge, which restores even for the same illness or same hospitalization, again once a year, only under gold and platinum. If critical illness isn't built in on your variant, you can add it as a 50% of sum insured rider on silver. One feature people ask about is Health 241. The idea is simple. If year 1 is claim-free, Zuno waives the premium for year 2. It applies at first renewal for new policies. The fine print matters, but it's a neat layer if you expect low utilization early on. Now, you can choose to pay a voluntary copay, 10-20% if you're under age 60 to reduce premiums. Just remember, you're trading lower premiums today for higher out-of-pocket at claim time. Now, there are other add-ons available under Zuno, but remember, details mentioned here are as per documents available for these add-ons. Currently, they might not be available or live for purchase. So please do note that. Newborn care. This covers a baby from day 1 of the birth. Coverage includes inpatient hospitalization in India for illnesses or injury on medical practitioner's advice, with some insured options either up to maternity limit in gold and platinum or the full base sum insured that is in all variants. There's also Oocyte Donor, which covers inpatient hospitalization for complications during oocyte retrieval, for hospitalizations over 24 hours, active treatment only, for a single donor and 1 attempt with sum insured options of 50,000 or 1 lakh rupees. Now, this cannot be renewed and applies only when the intending couple is covered together. Applicable for oocyte donors aged between 25 and 35 years. There's also Surrogacy cover, which offers some insured options of 50,000 or 1 lakh rupees over and above the base policy. Applies only when the intending couple or woman is covered together and cannot be renewed. Covers the surrogate mother's inpatient hospitalization for specified complications of surrogate pregnancy and lawful termination of pregnancy as prescribed by a doctor. Limitations to keep in mind: room rent mechanics can bite you if you drift beyond your entitled room, so stick to single private unless your variant explicitly allows more. Consumables like gloves, syringes, PPs, and so on are not covered in base, so expect some out of pocket here. And from age 61, that mandatory 20% copay can make senior claims noticeably expensive. Discounts. Now, what actually moves the needle? There's a small no claim discount which can be taken instead of no claim bonus on renewal in rupees 50 rupees on silver, 125 rupees on gold, 150 rupees on platinum. If you pay long term, you get 7.5% off for 2 years and 10% off for 3 years. There's also an employee discount, which is 10% for Edelweiss Group. As always, subject to underwriting and policy terms. Okay, now let's take a look at premiums, and through this, you'll be able to make a quick sense of how Zuno is priced across all the 3 variants. The premiums are on your screen. Okay, folks, now think of a super top-up as your second layer that kicks in after a deductible. Zuno lets you mix cover of 1 lakh rupees to 5 crore rupees with deductibles of 50,000 to 1 crore depending on the sum insured. Pricing is ultra lean and the premiums are on your screen. So folks, if you already have a base policy from Zuno or other insurer, this is a compelling way to stack up high limits at a low cost. If you want true staying power, pick a deductible that matches your requirement. So where does Zuno sit? Now at the base plan level, pricing is aggressive in low to mid band, especially at 10 to 50 lakh, where gold and platinum add noticeable value. Longer pre and post hospitalization, maternity coverage, higher ambulance and organ donor limits, and built-in critical illness on top tiers. Now, on the flip side, the mandatory 20% copay from age 61, no consumables in base, and restoration that's a different illness, only unless you add recharge. So you'll want to budget for the add-ons that matter to you. On the super topper front, the value is clear. If your family already has a base plan and you want big cover without big premiums, Zuno's pricing is hard to ignore. Just be thoughtful about the deductible and waiting periods. Let's see Ditto's cut. This is the balanced view. Alright folks, that was our brief review on Zuno Health Plan and their super top-up plan. Let me remind you that not all the plans are similar for everyone, and what plan that might work for someone else might not work for you, and vice versa is also true. So please, before you fix in on one plan, please make sure that you get a free consultation with Ditto or your advisor. And if you'd like Ditto to be your insurance partner, then you can check out the link in the description. The call is completely free. Our services are completely free as well, and we help you during claims as well. Alright folks, that was it. Please subscribe to Ditto channel if you haven't already. It's the simplest way to support Ditto's mission to make insurance simple and honest for all Indians. I will see you in the next one. Until then, happy insurance hunting.